looking forward to talking to you for Health Impact Live. We sit down with leaders to talk about current events, like what's going on in healthcare, what technology can do better. I'm Janae Sharp. We've met. Do you want to introduce yourself to the audience?
Sure. Yeah, Todd Larson, and I am currently in a couple of roles, which my primary role is consulting and education across the country. And I also still work for HonorHealth as a consultant in workplace and public safety. And HonorHealth is a medium-sized healthcare organization in the Phoenix, Arizona area.
Awesome. Yeah, I know the HonorHealth people, and you came highly recommended. No pressure.
No pressure.
No pressure. So when people think about workplace safety, I think about like that healthcare has some of the highest workplace violence and is having massive staffing issues. Like we're seeing tons of nurse walkouts. We're seeing all this stuff. But I think our audience actually knows more about workplace safety than I probably do. But I'd love to hear kind of what is top of mind for people right now. Like what is it that you're dealing with all the time?
Yeah, I think healthcare organizations, I put it in sort of a bucket of three when we talk about workplace violence. First off, you have the patient. Mm-hmm. Second, you have the family or the visitor or anyone else who may be there. And third, you also have the staff member. So you're mixing all three, right? You have patient, you have caregiver, you have family member, somebody else who might be in the room, a visitor. So I use this term. It's actually very dynamic. If things were down to the simplest of caregiver and patient, okay, that can have some complexities. But when you start having all of these other dynamics, it gets very complex. So that's compounded with staffing, as you brought up, the pandemic, PPE, gear being on, can you even have a communication problem? So I think it's a multiplex problem, but I have spent the last several years focused on addressing this from the staff perspective. Okay. So we at HonorHealth did a study, and we found how a very high percentage, and I'm not going to get into detailed math on this podcast.
This isn't a math contest, but later.
So let's just use like, very high percentage, very, very great majority, 3/4 plus, were assaults or workplace violence incidents on staff that were predicated by a verbal threat or a verbal announcement, such as, don't touch me, don't stick me with that. If you do this, I'm going to kick you. I mean, patients giving a verbal warning. So I think really, and I'm going to hit to the core of it, like quickly, I think really is that caregivers are caregivers, whether you're a nurse, whether you're a physician. I'll stick with sort of in a tech. Let's say you have a tech, a nurse, a physician, nurses being the bulk of the hands-on patient care. You're a caregiver first. So commonly it's, maybe you don't hear that comment. You're thinking about giving your dose of medication. You're thinking about giving a shot. You're thinking about doing a bedroll of the patient, and so your primary condition is to care. So it's care for the patient. So I think that compounds the workplace violence problem, is that nurses and clinicians and staff are constantly thinking about care of the patient and don't always think about care of themselves. And so what I think gets to the heart of it is we have to conduct training. Everybody out there wants to sell solutions for millions of dollars and this wearable or this device or that. And really, I think it gets down to, and the things we did on HonorHealth get down to just really working with staff, training staff, recognition, hearing a comment, backing away, standing in the doorway, asking for someone else to come in the room and help you, scoring systems, charting, all kinds of ways that you can preempt an event from happening. That's the real way with workplace violence. Right. Let's prevent it from happening. Or if it was to ever happen, it's a total surprise and it was nearly impossible to mitigate. So that, I think that's at the core. Caregivers being caregivers and maybe retraining the mind to pick up on those verbal and or body cues, sometimes a straight up threat. Don't touch me or I'm going to hit you. Well, then don't touch the patient at that time. So
Right.
those types of things, that's what that's where I think we have to go with workplace violence. And in many ways, it doesn't involve spending millions of dollars. It's really, really something that any healthcare organization can get focused on today.
Right. That's an interesting point too. So in a prior life, before I went to healthcare, I briefly was a teacher, and they tell you that the most powerful tool you have is always proximity. Like for a student who's struggling or for something, and you don't really realize how important that is until you're like in a classroom full of second graders who are like doing tumbling and they need that grounding force. And also I like what you said about listening to patients. It's hard though, because when you have that, people come and ask and you're like, well, how is that scalable? Like if you're doing one-on-one training, is that scalable? And how is that scalable when you're having turnover? Like, do you have to retrain staff that are coming for travel nursing? Like, did Honor have to go through that, or is that a different discussion?
No, it's clearly part of the discussion,
Right.
whether it be traveling staff, whether it be turnover, those are always going to come up. I think the
Right.
key that we think about with what we talked about to start this off with training and knowledge and education is culture. Culture trumps everything else. Culture is the foundation. So if that is your culture of safety and that is your culture of supporting your staff, and you support your nurse or clinician when they have a concern and they know their voice is heard, and you provide the resources and training. So I go back to the culture portion of it, that if that's your culture, that anybody who comes in sees that that's your culture and knows that it's part of your fabric. And I think it carries on. The study and the training we did started back way back in 2018, and we're still seeing decreases in workplace violence as opposed to the rest of the country that is seeing double-digit increases. And that's not to say that technology doesn't help. There are technology things that we can build out and do, but those to me are enhancements on the people. I think all too often people look to technology to be a solution versus technology should be looked at to be an enhancement or something that helps to enhance things you're already doing, make things more efficient, create things. We can't just, every time you buy a solution doesn't necessarily get you there. So I'm a fan of technology, but technology built upon that layer of culture and training.
Right. I like that. Also, congratulations on decreasing rates. That's a big deal.
It's a huge deal. Yeah.
I'd love to hear more about your background. How did you come to healthcare? Because you have an interesting story, like how you got there and why did you feel like it was a good place for you?
Yeah. Let me start with this. What I did not realize is that I've always been a healthcare worker. So my story, coming out of the military, I joined the Scottsdale, Arizona Police Department, where I worked for over 22 years. Looking back on that career, once I was in healthcare, I realized the majority of my job was healthcare, whether that's responding to accidents, trauma, vehicle accidents. But then you think about it, behavioral health, um, you know, drug abuse, alcohol abuse, domestic violence situations, personal injury, counseling. Wow, if you really think about it, what much of what a police officer does is actual clinician type work. You're helping people, whether it be with a disease, whether it be with drug addiction, whether it be with actual violence and injury. So I came into healthcare because my last role at the police department involved being the director over the Family Advocacy Center. And that is a multidisciplinary building where you have law enforcement, you have counseling, you have medical, the forensic nurses, and you have investigations as well as some other state agencies, all within the same building. And so I developed a relationship with the nurses that were caring for our patients coming into the Family Advocacy Center. These are our domestic violence victims. These are sexual assault victims. And so these nurses would care for these patients. And I developed a relationship with them and their leader. And one day he said, I'm going to be leaving. I have to move to Washington, D.C. My wife's getting a promotion. You should put in for my job. You'd be competitive. And so that started my journey into healthcare. I retired from law enforcement. I went into healthcare and had a wonderful time at HonorHealth running the military partnership, where we train the military personnel in trauma medicine from around the globe, as well as, you know, the other jobs that I had, their service lines involving security, emergency management, access control. And then, you know, one of the last projects I worked on and spent time working on was the creation and build out of the Network Operations Center.
I want to hear more about the Network Operations Center. Like, I know we have this foundation that humans matter most, like, and it's the human factors that matter, and that technology, I'm also a big fan of technology, by the way. Technology should enhance it. Technology should be an asset. How do you build out a command center? What is that? I mean, people probably know, but yeah.
Well, yeah, you know, it's interesting because I think there's dispatch centers, there's command centers, and what we're really trying to do is enhance all of that into almost a complete fusion center or coordinated care center, so that everything's all together. But how we initially did it is we focused on operations, things that are operation related. So for instance, the first group to actually move into the Network Operations Center, we had a building on one of our campuses. Number one, I think it was crucially important to put it on a campus. It should be on a medical campus, not a standalone building off, you know, not the old shiny building on the hill, right? It should be on a campus, part of the fabric of the system. Number two, we focused on integrating services that can be part of the command and control feature together. So the actual first team to move in was on the nursing operations and the clinical operations side, with the transfer center and bed control and float pool and labor, as well as transports, patient transports. So we moved sort of all that inside operations, whether it be staff, patients, you know, procedures, all of that moved in, and they're in one portion of the command center. The other portion of the command center that they're about to move into, by the way, tough to build a command center during a pandemic with supply chain shortages. I'm just going to say that. So
was it your favorite?
No. So the other side of the command center is what I would call sometimes a traditional command center. You're going to have security and cameras and all. When I say technology, all the technology, right? So I'll give you an example. We had a clinician who had an item stolen out of a locker, and he came in to do a surgery. And that, when we did the investigation, we found that the reason it had happened is that the back door had been propped open. So I'll give you an example of a command center. Had the command center been up and running, the back door propped open, after 20 seconds or 30 seconds, whatever you set the timer, the alarm would go off, the camera would alert to the knock, the picture would come up on the screen, and we could say, hey, security, go check this door. Why is it propped open? And within 1 minute, that situation would have been remedied, right? And no one would have been able to walk in the back and say. So that's the traditional command center. You have cameras, you have security, you have alarms, whether it be temperature monitoring or refrigeration or med and gas, all those traditional things, and dispatching security. But where we're trying to go is the next level. So let me put this out there. When you think about healthcare, there's a couple of models out there. There's the model of you're completely free and open. And then there's all the way to the model of you have metal detectors, and there are hospitals out there that have metal detectors and armed personnel and sometimes police departments that are locking a hospital down. And I'm not judging either end of that. But to go on one end, that's very labor intensive, very cost intensive, and you have to pay a lot of labor to run, high level security. If you think of it like a courthouse or some type of jail or something where you have these metal detectors and armed personnel. But here's the thing, this is me saying, is that really what patients want? Is that really what family want? Do they want to have to go through metal detectors and armed guards when they come to visit their mother?
No,
So
it's a
I
little
think
it's a little unsettling, you know?
yes. And so, and on the flip side, how is it that I can order a package on a company like Amazon, and from the moment I hit enter or purchase on my computer till the moment it's at my door, I know everything about that package. I know where it's at, where it's scanned in, when it's going to be here. I know everything about it. Now I want you to try to call your local hospital and say, I'm trying to get hold of my grandma. I don't know what room she's in. You tell me how long that takes to actually get connected up to your
Right?
grandmother's room. So when I say network operations center, where we need to go, and this is where technology comes, is if we don't want to be the hospital that's locked down like going to a courtroom or prison, and we don't really want to be foolish, right, and be just completely, open all our doors to everything. I think we have to look to technology. So we think about how does a hotel in Las Vegas like the Bellagio, how do they run hundreds of thousands of people a week through there, but yet when they have a fall, they can detect it in seconds. They have cameras that can read the serial number on the bill that you're using at a gaming table. They can move people through effectively and safely all day long. So they do that with technology and they do that with training. It's the same with banks. I
Right.
had a career in law enforcement, and banks are often, robbed or money taken. But it's one of the highest solved crimes in the world. Why? Because they focus on two things. They train their staff really well
Mm-hmm.
on what to do, and they have great technology, cameras and die packs and things that are in the money, and then cameras to go with it. And they have charting on the doors, and they have all these things that they put together, so that you can walk into a bank and you don't have to go through metal detectors and feel like you're in a prison, but you can walk into a bank where there's all kinds of money, and yet you can walk in and out freely. And when they are a victim of a crime, it's one of the number one solved crimes in the world because of their commitment to people, culture, training, and commitment to technology. So where the knock is going, is to continue to build in those things. Can we build in registration? Why can't you log in ahead of time to visit your mom, get a barcode or a QR code, come into the hospital, hit the QR code, gate opens, go through, into the hospital. We now know who you are. You're in the hospital, you're walking around. Combine that with cameras. Those cameras can identify, an employee badge. They would know if you're an employee. If you don't have a badge hanging on you, they would recognize you as a visitor. And I'm not talking about facial recognition that people get, crazy about and don't want privacy. I'm talking about just general things that can help us flow through. And then we move forward into what we talked about earlier, all of those other operations things that can come in there, whether that's supply chain, whether that's the movement of patients, as we brought up. In our current network operations center on the clinical operations side, we have had community partners such as ambulance and that come in now and physically want to work in that space with us so that they're integrated with us. We've been able to take queue times on patient transports from 12 to 14 in the queue time to 0
Oh, wow.
because of having this centralized network operations center approach. So I know I hit a lot of things there, Janae. I'm
That's a lot.
sorry.
It's a lot.
I hit a lot, but this is where healthcare needs to go. Coming out of a career and spending, the last 8 years in healthcare, I thought, government was behind. Yet then I come into healthcare and wow. So we need to get rolling, because it's not acceptable to tell a patient's family that I could track the package into their patient room quicker and faster than I could actually track clinical care going into that patient's room.
And that's interesting too, with all the supply chain issues that have kind of highlighted it. So I like the meme that always goes around where it's like USPS, we don't know if this package exists, delivered. And then it's like Amazon, it'll be there at 9. And then it's like Facebook, you thought about buying this.
Right. And you just hit it all. How is it that in all of these other industries, this stuff is happening, yet in healthcare, I understand HIPAA and I understand all that, but in healthcare, there's this cloak of paralysis by analysis and this, bureaucratic slowdown versus we could, and that's I give so much credit to HonorHealth and the amazing push that they have had with of let's try to be so efficient and let's try to put all of these services together in a network operations center so that at the end of the day, we're giving the best care to our patients. Right. That's really why HonorHealth is doing it. They really care about their patients, and I get, to me, it matters, right? I mean, living in the Phoenix area, Scottsdale area, I've been a patient at these hospitals as well as working for them. So I see firsthand that the care is for the patient coming in. So I think you have to look at it from that aspect, back to whether it's workplace violence or network operations center. If you put the patient at the center of what you're doing and you focus on integration and you focus on bringing in these things together from a symbiotic relationship, then I say, back to your point, we should take some of the best things Amazon's doing and Facebook is doing, and we should take their best things and bring them into healthcare. Doesn't mean we need to replicate what they're doing, but we should take the best of the best, and I've tried to do some of that. We did a lot of that with our vaccine model. We did a lot of that with other models where how can we make things efficient and safe by learning what others are doing.
Right. I love that. From a leadership perspective, what is it that makes the difference for them? Like, you've worked with them. How do they get there for leaders that are watching?
So, having been, a mid-level leader, at HonorHealth as an associate vice president, and now still there as an employee, but really in a consulting role. And I have to back up. I have to say it really ties into what I saw in 30 years, right? So I had a 22-year career in law enforcement in the city of Scottsdale, of which HonorHealth has 3 hospitals. So I was, as you can imagine, in law enforcement, I was in and out of these hospitals constantly for 22 years, and then working there the last 8 years. So I'll go to this. I have seen a continuous and constant culture of care for 30 years.
Wow.
And that's number one. Number two is that they focus on leadership that is both from the organization, B, from outside the organization. So they have a mixture, right? But also that they focus on leadership that is there for the right reasons. So if someone comes from another organization, or if someone comes up through the organization, at the core they have the same values, they have the same culture. So I use that word culture. I think culture is incredibly important. So when you look at Todd Laporte is the CEO of HonorHealth, he is created and maintained, really, because even prior to him, great culture. So that's number one. Number two is that the leaders that are in place are both very good at what they do, meaning all of them, in my experience that I worked with, were great practitioners and then moved into leadership roles over time. So having done the task and then knowing the task and now leading the task, I think is very important, because the staff trust them. So let me put this all together in why I think leadership.
I was just going to ask you, I was like, well, we're wrapping up. So how are we going to?
I think the greatest example is number one. I was once walking on the Osborne campus, which is one of the HonorHealth hospitals, and I saw in front of me our CEO, Todd Laporte. And he's walking down the sidewalk. I saw him greet someone on the sidewalk and provide directions. Then I see him stop because a piece of paper was on the ground, like in the rocks, and he picked it up and walked over to a garbage can and threw the piece of paper away. And then he went into the hospital and met with, this is the CEO, right? He is talking with patients, looking what entrance. He's picking up a piece of garbage and putting it in a garbage can, walking over to that. I mean, saying, like, showing that he is all, there's no talk there. That's actually who he is in the fabric of every little bit of this organization. To, in the same day, I was over in the emergency department in the trauma bay, and the trauma director was dressed very nice, civilian clothes. I don't know what she had, but some type of meeting where she was dressed very nice in civilian clothes. And all of a sudden, trauma is coming in, another trauma is coming in. It's a level 1 trauma center, incredibly busy. And she runs over to like the scrub machine, gets a set of scrubs, and immediately changes. And she's over there, just in it.
Right.
And so, and you could say that about, the executive vice presidents. You could say that about, the chief financial officer. I don't care where you go. Leadership is key. And what the leadership does at that organization, at HonorHealth, is sets a culture all the time. And that culture is what's best for the patient. And they live it, it's an amazing place. And I think they do an amazing job for the community.
That's good. Well, I'm grateful that they are doing that, and also that you're able to come share that story and share some of that expertise about how to get there. And we will have the live roundtable at 4 p.m. You have to come. And I'm really looking forward to like the future of that and the future of having centralized command and better technology.
Yeah, and also being open to more things that could go into centralization, right? And more things that could be part of that. Because I don't certainly have all the answers. And I think that we need to continue to reinvent. And I don't mean that from, throw everything away that we've done in the past. I mean it from, we need to reinvent constantly based upon our entities, healthcare, based upon looking at what others are doing, based upon what everybody from, staff all the way to the CEO, everybody in between. Let's put all this together, because somewhere in there at any given moment is a great way to do something that's probably, better than the why we've always done it this way. So,
Right.
Yeah, I think it's exciting. I think healthcare is on the verge of an explosion of efficiency the next 10 years. How are we going to take all of these things coming at us, technology and ways and means and people and change and telemedicine and all of these things that are coming at us, and now integrate that out there? It's really an exciting time.
Yeah. I love that. The vision of the explosion of efficiency. Well, thank you.